Hello, everyone. I'm Sanjana Pandit, and welcome back to Infusions of Art, a mini-series dedicated to spotlighting some of Houston Methodist Hospital's renowned physician artists and artist caregivers. For today's episode, we will be hearing from Dr. Jolly Patel. Dr. Patel is a sports and orthopedic physical therapist. Her focus has been working with patients with orthopedic-related injuries throughout the lifespan, from rehabilitation of young dancers and athletes, postpartum mothers, to the geriatric post-surgical population. She has always been very conscientious about posture and ergonomics, and she loves teaching patients proper posture and movement to function optimally. She's a native Texan who attended University of Houston for undergraduate work in kinesiology and dance, and went on to receive her doctorate in physical therapy from Loma Linda University in California. She practiced in Southern California for over a decade, and now practices in the greater Houston area. In 2020, Dr. Patel established Patel Physical Therapy, a private practice meant to help patients along their wellness journey to getting back to their best life. So with that, huge welcome to Dr. Patel, and thank you so much for being here with us today. To start off this interview, I would love to hear about how you first became involved in physical therapy. Why did this form of care appeal to you?
So my background has been gymnastics and athletics. I come from a family of athletes, you can say. My grandfather used to practice yoga very heavily. My dad was a marathon runner, a gymnast, swimmer. So, and then, I kind of followed in his footsteps. I used to run track and cross country in middle school, high school. And it was just something that fascinated me because I felt like I could combine my love for sports and athletics and orthopedics with medicine. And I'm a people person, so I thought this was a great career to go into.
You seem like a very well-rounded person, Dr. Patel, so I would love to know how this background has enhanced your medical career.
When I do have patients who, are dancers, ballet dancers, gymnasts, athletes, runners, I'm a runner, so it's very easy for me to reference, okay, well, I used to do this. This is what it takes. I know that, for example, if I have a gymnast, she might have a shoulder injury, but I also know, being a gymnast, that you need, core stability. So just, your background and what you did as an athlete, you could use it with your patients. You can relate with what's going on with them. You learn ergonomics, you learn how to analyze gait, so you've kind of seen it all. So your background in whatever sport you used to do, or even in dance, it just helps you with not just the patients who are a dance background or athletic background, but even your normal patients, right? So if you, for example, I am, as you said in my intro, I'm very conscientious about ergonomics. So when I treat a patient, for if it's like a shoulder patient or if it's a back patient, I make sure that when I'm treating the back or the shoulder, I'm not compromising another body part, right? So a lot of times, for example, I'll see someone with a back injury that, they do all these exercises. They, as in like the PT, will do a lot of exercises with the patient, but then they forget, okay, well, if the patient is sitting at the edge of the bed, they're hinging their back, so you should, support them and give them a step stool. So there's just so many things that when you practice what you preach at home, you could take it to your patients.
I love that. So to what extent has your cultural upbringing, more specifically, influenced your way of life and or the way that you approach treating your patients?
So, as I had mentioned that, my grandfather used to do yoga, my dad used to do yoga. I never practiced yoga on a daily basis, as I probably should. However, just knowing the importance of yoga and breathing, that has really helped me with my treatment with athletes, as well as, like, for example, the elderly population or postpartum patients, because what happens is when you breathe and you exhale, you can actually elongate your muscles better, right? So I incorporate that with my patients a lot. And a lot of times I could tell when they come, they're so tense or, they're so busy with work that I have to tell them, slow down and breathe, just that's what you need to do, breathe. Because I believe every cell in your body needs oxygen. And, if you breathe, you're doing yoga, you're giving all those cells oxygen to function optimally. That was kind of a part of what I did growing up. And I use that with my patients, whether I'm working inpatient or outpatient. I always at some point incorporate some sort of breathing yoga exercises with my patients.
If you had not pursued a career in medicine, what alternative career path could you have considered? Would it have been something in the performing arts industry, or what are you thinking?
Yeah, I love dancing. When I was young, I used to love dancing so much. And I used to follow, Bollywood a lot. And I thought, oh, maybe, I can become like a Bollywood actress. But honestly, I thought if I didn't go into PT, I would have probably gone into either genetics and genetic engineering, which was something I was very interested in, a dance teacher, or I would have gone into, like a coaching gymnastics. I just found this career and I was like, this is it. This is what I want to do.
It called to you.
Yeah, it was a calling.
Now, you and I were discussing earlier how now you have started to take dance classes again. So I'd love to hear more about that journey, that stage in life now, how you're enjoying it, how it's coming along.
Yes. So growing up, my background is more so in gymnastics. And as far as dance is concerned, my background is in classical folk Gujarati dance. And I feel like a lot of the dances these days, if you want to treat dancers, you should have a background in ballet. If you want to treat dancers in the United States, if you want to treat dancers, for example, in India, you should have a background in some sort of classical dancing, because there's a lot of classical dancing that you need to know. So there's a lot of research and treatment approaches for ballet dancers, modern, all those dancers in the United States, but there's not enough research, evaluation, and treatment for Eastern dances. So my goal is to develop a program to treat Eastern dances, for example, Bharatanatyam or Kathak. What I'm doing now is I'm putting myself back into learning because I don't have a background in that. So I'm taking Kathak classes. I actually was lucky enough to find a company that takes on adults. So I'm learning Kathak. I want to get certified and I want to graduate in that. And I want to learn, just the basics. And it's actually amazing. I am a gymnast, a dancer. I go to yoga, I run. However, when I take Kathak classes, some of the movements are very hard. I mean, you have to have a lot of balance. You have to have a lot of core stability, a lot of shoulder movements that I didn't even realize that I was lacking. So it's amazing. And when you actually immerse yourself in that field of dance, then you could treat the dancer better, right? And you can come up with a treatment for that sort of dance. Now, I also started taking ballet classes a couple of years ago because I also wanted to learn the basics. Again, like when I see dancers, sometimes I don't know what they're talking about. I'm like, oh, what is that? They're like, when I did this, it hurt. So I don't know what this is, so I have to learn.
Mm-hmm.
Yeah, so that's kind of what I'm doing right now in my dance medicine journey.
As a classically trained dancer, I'm like beaming from ear to ear hearing you talk about this.
Yeah, which form of dance are you trained in?
Oh, Bharatanatyam.
Okay, very good. Who was your teacher?
Guru Padmini Chari.
Okay.
Yeah,
doesn't sound familiar.
She settled here in 1982, I think. And she taught my mom and now me and my sister.
That's very cool. Very nice.
Where do you see yourself going in the next 10 years?
Well, one of them I just talked about, evaluation and treatment for classical dance, but also gymnastics, that, and there actually is all, it's not something that I need to develop or come up with. There's already a lot of people who do that. I just want to immerse myself into it more. Also, something that I had the privilege to do when I was living in California was we were working with children with developmental disabilities. And so there are not that many classes or activities for those students. Seegerston Performing Arts Center had a program where, they took in children with special needs, and they would teach them, dance and music and singing. And it was a wonderful program, and I'd like to get into something like that as well for the community. Anything that has to do with dance and in all avenues.
Do you have any advice for, motivated young students in college or who are interested in pursuing possibly a career in medicine and are considering how to balance that with an artistic talent?
Whatever you want to really focus on, definitely there's a lot of research, so find all the research that there is, research, where that profession where that profession is going. I would also recommend, volunteering in hospitals. I know Memorial Hermann has a every month they do a ballet evaluation for dancers. I would recommend, become part of all the communities. I think Houston has a houstondance.org. One thing that I wish that I did was, if you're really interested in dance medicine, NYU has a Harkness Center for Performing Artists, and I think they take internships. But, there's so many places like this. There's NYU, there is Methodist, CPAM, there's also UCI. So anywhere that you can get some sort of internship or research to actually work with dancers, I think that would be the best thing you can do. And also there are a lot of private practices that actually have Con Ed classes as well. So I would just immerse yourself into something like that. Yeah, but this is the time to do it, when you're young and you have more time on your hands.
To close off on what has been a wonderful interview, Dr. Patel, do you have a favorite quote or a saying that captures how you feel about medicine, fine arts, or both?
Well, I feel like my favorite quote would be, "Life is a dance, find your rhythm." What I mean by that is, I feel like you don't have to be a dancer. I think everything we do is kind of a dance, right? Like from the time we wake up, I feel like when I make my coffee, I have this routine in the morning. It's like, it's my morning dance, When I go to work, you have this dance where you're getting everything ready for your patients to come. I think that's what everyone needs to do is, find their rhythm in life. CPAM is it's like they've done so much for the community of Houston. I'm amazed. There are places like Methodist, CPAM, UCI, all these places who serve the performing artists, because I feel like that's an underserved community. When we think of, sports medicine, and we think of doctors working with, I guess you could not like famous, but people that are not patients, it's typically athletes that get a lot of attention, right? So this is a great place for performing artists to also get served in the medical community. So that's great. Well, thank you so much for having me. It was great.
Of course, the pleasure was all mine. Thank you so much for your time, and thank you all for tuning in for day 5 of Infusions of Art. I hope to see you all in the next episode. Until then, take care and have a great rest of the day.